A decision support system, or DSS, is an information system that aids a business in decision-making activities that require judgment, determination, and a sequence of actions. The information system assists a mid and high-level management of an organization by analyzing huge volumes of unstructured data and accumulating information that can help to solve problems and help in decision making. A DSS is either human-powered, automated, and combination of both. Clinical Decision Support Systems, or CDSS, are computer-based programs that analyze data within AHRs to provide prompts and reminders to assess healthcare providers and implementing evidence-based clinical guidelines at the point of care. Applied to cardiovascular disease, CVD prevention, this three-domain strategy can be used to facilitate care in various ways. For example, by reminding providers to screen for CVD risk factors, flagging cases of hypertension or hyperlipidemia, providing information on treatment protocols, prompting questions on medication adherence, and providing tailored recommendations for health behavior changes. Now let's proceed to goals. Patient safety. The patient safety is how hospitals and other healthcare facilities safeguard their patients' wellness by avoiding errors, injuries, or accident or wrong judgment calls that may cause harm or endangered lives. Improve outcomes for specific patient populations, compliance with clinical guidelines, standards of practice, regulatory requirements. But the primary goal is to optimize of both the efficiency and effectiveness with which clinical decisions are made and care is delivered.
So I am Jessica Umbo, and I am the one who tackle about tools that help nurses improve their effectiveness, identifying appropriate interventions, determine areas need of policy or protocol development, and support patient safety initiatives and quality improvement activities. The definition of this: CTS is any computer program that helps health professionals make clinical decisions. And the Johnston computer software employing a knowledge-based design for sure by a clinician involved in patient care as a direct aid to clinical decision making. CAMS. It is the software designed to be a direct aid to clinical decision making in which characteristics of an individual patient are matched to a computer clinical knowledge based on patient clinical assessments or recommendations are then presented to the clinician or the patient for a decision. And the third is COIRER, a role of CDS, augmenting human performance and providing assistance for healthcare providers. And the BER, NER, is a healthcare is being transformed through information and knowledge management, and technology is being used to tame data and transform information. And expanded uses of CDS. Randall Tobias. It is a former VP and ATP. It is a computer has virtually unlimited capacity for processing and storage of data. It is a human has limited storage or memory and processing power, but does have judgment, experience, and intuition. Ito ay ang mga kagamitan na tumutulong sa mga nurse na mapabuti ang kanilang pagiging epektibo sa pagtukoy ng mga naaangkop na intervention or pagtukoy ng mga lugar na nangangailangan ng pag-unlad ng patakaran o protocol at sumusuporta sa mga hakbangin sa kaligtasan ng mga pasyente. At ito din ang mga kagamitan ng mga computer or system or software na makakatulong para mapadali ang pagproseso ng mga papi sa mga pasyente at mapabilis ang pagproseso ng mga pasyente dahil sa mga tools na ito. Nakakatulong ito sa bawat mga nurse or sino man ang may trabaho sa hospital or in a clinic. Ito ay nakakatulong sa kanila upang mapadali ang pagproseso sa lahat ng mga kinakailangan nila, tulad ng pagproseso nga ng mga papel ng mga pasyente.
Three main purposes of a DSS: assess in problem solving with semi-structured problems, support not replace the judgment of the technician or the manager or the clinician, improve the effectiveness of the decision-making process. History of CDSS. Early system, focus on diagnosis. Earliest known CDSS developed by D. Dombal in 1972 at Leeds University. Used Bayesian's theory to predict the probability that a given patient based symptoms had one of the 7 possible conditions. 1974, Internets developed at the University of Pittsburgh to support the diagnostic process and general internal medicine by linking diseases with symptoms, later became the basis successor system, including quick medical reference. In 1976, MySyn, role-based expert system to diagnose and recommend treatment for certain blood infections. In nursing, two early and well-known system, the COMS or the COMES, creation online multiple modular expert system, the CANDI, computer-aided nursing diagnosis and intervention. These were developed to assist nurses with care planning and nursing diagnosis. Types and purposes of DSS. Types of DSS: administrative and organizational system. Administrative system, financial or quality monitoring, generally support the business decision-making process, encompasses decision process, tend to batch ordered, focus on real-time support, goal orientation, intelligence gathering, to design to be used at the point of care by clinicians.
I will discussing first integrated systems. Integrated systems support outcomes performance management by integrating operational data, budgeting, executive decision-making, financial analysis, quality management, strategic planning data. Characteristics of DSS: short life, uses function, mode of advice, consultation style, underlying decision science methodology, and user-computer interaction to categorize systems. Tyke and Green examine DSS from the aspects of functional and logical classes and structural elements. Perrault organized K CDSS function as administrative, support for clinical coding and documentation. Example: phone, email, calendar, internal communications, preparing reports, and some human resources functions. And the second one is management of clinical complexity and details, keeping patients on research and chemotherapy, protocols, tracking orders, referrals, follow-up, and preventive care. CDS tools include order sets created for particular conditions, or type of patient's recommendations, and databases that can provide information relevant to particular patients. Third is cost control, monitoring medication, orders, and avoiding duplicate or unnecessary tests. And the last one is decision support, supporting clinical diagnostic and treatment plan processes, promotion of best practices, use of condition, specific guidelines, and population-based management.
Good day everyone, I am Rex Lamigo and I will going to discuss to you the 4 divided DSS. The first is the database system, second is the model-based system, third is the knowledge-based system, and the fourth is the graphic-based system. And now let's talk about the database system. Database system is capitalized on the fundamental input into any intelligent system data. Provide decision support. For me, database system is nagbase siya sa data of the community na kailangan og moral support or kailangan og support. Then, OLAP. It means Online Analytic Processing. It is a technology that organizes large business databases and supports complex analysis. Next is the model-based DSS, driven by the access and auto and manipulating of a statistical, financial optimization and or simulation model. Ang model-based is nag-base siya sa isa ka standing sa isa ka community. Kung kailangan ba siya og support or any statistical, financial, ingana. Next is the generalization that can be used to describe the relationship among a number of observation to present a perception of how things fit together. Then genetic algorithms or GAST and neutral network or NNS. Newer computation techniques that are evolving as a problem-solving solution.
Knowledge-based systems rely on expert knowledge that is either embedded in the system or accessible from another source and uses some type of knowledge acquisition process to understand and capture the cognitive process of healthcare providers. Graphic-based systems take advantage of the user interface to support decisions by providing decision cues to the user in the form of color, graphical representation options, and data visualization. Demand Management Center use decision tree logic or rule-based logic for patient management. DTL used for specific straightforward tasks. RBL allows for complex decision capacities. More flexible with answers, provides consistent outcomes, and is adaptable to change. Also tends to have rigid solutions and allows little or no clinician autonomy.
Good day, sir. My name is Sarah Pagalan and this is my assigned topic, taxonomy for CDSS. The number one is context. The context axis of the CDSS taxonomy describes setting, objective, and other contextual factors of a system use. 77% of the CDSS were used for outpatient care, 19% for inpatient care, and 5% for care not affiliated with a healthcare entity. Another context characteristic is the target decision maker. The person whose action the CDS is designed to influence directly through its recommendation. Number 2 is knowledge and source data. Axis of the CDS taxonomy describe the source of the clinical knowledge and source and format clinical data used by CDS. Number 3 is workflow. Workflow integration and workflow flexibility and staffing impact and crucial but often difficult to characterize features of a CDSS. We coded CDs as being moderate integrated to well integrated with clinical workflow if the CDs did not require subsequential additional work such as receptionist, reading to enter patient and demographic information. 4 is decision support access. Describe the natures of the decision making targeted and the nature of the decision support offered. 86% of the CDs is targeted to drug dosing and prevention. Number 5, information delivery access. Describe how CDs deliver their action, recommendation, and target decision maker. For the patient, the most common were postal email, 76%, and telephone, 21%. For the physician, the most common formats were online within integrated CDC session. Institution of Medicine or IOM, human error as major source of patient care morbidity and mortality. An error is defined as a failure of a planned action to be completed as intended or the use of a wrong plan to achieve an aim. An adverse event is an injury caused by medical management rather than the underlying condition of the patient. Barriers to use of CDE system. The bits. Practice lags behind knowledge to several years. This lag could be shortened if not eliminated by the ability of current knowledge to support the decision-making process. Learning occurs when move information from the working memory to long-term memory. Practice help this process keep information in our short-term memory long enough for it to move long-term. Henry identified essential elements needed for an informatics infrastructure. Number 1 is standardized vocabularies to describe patient diagnosis, intervention, and outcomes. The benefits of standardized vocabulary is to have better communication among nurse and other healthcare, provide increased visibility of nursing intervention, and improve patient care. Number 2 is computer-based methods to examine linkage among patients' problems and practice healthcare intervention, patient outcome, and intensity of care source, and to examine practice variation. This example is control lab equipment, blood pressure monitor, heart rate monitor, and other medical equipment. Number 3 is an integrated clinical information system where data required for quality improvement are both collected and returned to provided during routine process for patient care. To assess healthcare quality are available for many sources including data, claim data, patient's medical record.
So I will discuss first is integrated real-time patient data, which combines patient data from multiple sources, laboratory, radiology, pharmacy, admissions, nursing notes, and so on. So this is patient data, patient charts, so good sa i-admit siya, results sa laboratory, ug unsay mga reseta, and etc. And then the second one is the data drive mechanisms. It triggers to go into the effect and activate alerts and reminders automatically. And then third is knowledge engineer. It translates the knowledge representations scheme used in the system so that the clinical knowledge in the system can be extracted and translated. Then the fourth is time-driven mechanism. It is automatic executions of programs at a specific time to alert provider to ensure that the actions had been completed. Then the fifth one is long-term clinical data repository. It means that data collected time from a variety of sources.
Cognitive Task Assessed Analysis or CTE. It is the set of methods that attempt to capture the skills, knowledge, and processing ability of experts in dealing with complex tasks. Also that attempts to identify pitfalls or trouble spots in the reasoning process of the beginner or intermediate level practitioner. Then, goal of CTE. It is the top into this higher or order cognitive function. Tenant-shift. 6 steps approach to CTE. 1 is identification of the problem to target in the analysis. Second, generation of cases, decision tasks that vary on key factors. Third, observation of a record of an expert problem, solving for the case using think aloud. Fourth, observation of the novice and the intermediate problem solving. And the fifth is analysis of expert versus less than expert problem solving. And the last is recommendation of system needs, design, specs, and knowledge-based components.
Implications for future uses of CDSS in nursing. CDSS can improve professional performance by making the basis for decisions explicit, widening available information, encouraging more consistent decisions, and thus reducing unwarranted variation in processes and patient outcomes. Increasing inclusion of patients. Allow patient access to the knowledge base of the system. The computer can become a patient health medium with reference databases, library access for healthcare information, drug and disease management information, self-help programs, and advice about prevention available. Dual purpose of documentation. Balance the use of poorly designed or inadequately tested systems with available clinicians being forced to make patient care decision making without existing evidence at the point of care. Dual purpose. First, improving care for the individual patient. Second, improving care for the future populations of patients via aggregated information used for clinical decision making. SDSS can improve patient care quality, reduce medication errors, minimize variances in care, improve guidelines compliance, and promote cost savings.